Good evening, and thank you very much for coming through. Do you think it's xenophobia?
Evening for you. I think, as Amnesty, we've been tracking the comments that are being made by government officials around foreign nationals, and it's concerning for us, that that government officials come out and make statements that are not based on fact. And, this is a country that has high levels of xenophobia. And let's go back to Minister Motsoaledi. I mean, he makes claims like during this time when he spoke about this, he was at one health center and he claimed that out of 700 babies that were born there, 400 were born to foreign nationals, and then retracted and said, well, I don't have evidence to back that. And I think that's been our experience with the government officials. And I can give you a whole list of officials who have come out and said statements that were totally unfounded and untrue about foreign nationals. And one of the things I just want to say to you is that even this whole thing about foreign nationals flooding the country is not based on any fact. In 2016, Stats South Africa did a community survey, and in the community survey they found that out of 55 million South Africans in that community that they surveyed, I think it was they were looking countrywide, 1.6 million were foreigners. So I think that it's not true that the country is being flooded by foreigners. And in what we're saying to government ministers, stop using distraction tactics for non-delivery of things that you were supposed to deliver on. Motsoaledi has been health minister for 10 years. Why has he not fixed the health services? And it's very easy to blame others, but I really think government has to start taking responsibility for not delivering basic services to the population of South Africa.
Is he clutching at straws, basically, precisely because he has no explanations for why they are doing badly?
Vuyo, foreign nationals are a soft target. Anything that goes wrong, you say, okay, well, it's because of these people. But let's be honest. The reality is that our health services have been crumbling for a while now. Again, the government starts talking about a national health insurance plan. And then you have Motsoaledi a couple of weeks ago saying, well, we don't have the money for that. My question is that in the over 2 decades since South Africa got its independence, why have the health services not been brought up? And now as we're moving towards elections, as we're moving towards campaigning, they've got to answer. They've got to answer. People want to know why they go to hospitals, why babies are kept in boxes, why people are not getting the services that they have the right to. And of course, they instead of taking responsibility and saying, okay, he has said that we need more health services, but we also need to make sure that the ones that are existing are working. So let me give you an example. In 2012, we did a survey where we looked at abortion, access to abortion in 3,880 healthcare centers. Only 250 provided any semblance of a woman being able to go there and get abortion. Less than 7% of the healthcare facilities provided that. And that's in a country where the law stipulates that a woman has a right to safe abortion. So there's something wrong, and they need to fix it instead of scapegoating foreign nationals.
So in your experience as an organization, what would have happened? You've stated the most obvious one, right? But what would have happened to drive politicians to such desperate lengths, that the only thing they think will stick or make sense to whoever, is saying, is blaming it on the foreign nationals?
Well, I think they're tapping into the xenophobia that already exists. The fact that, South Africans in many of the townships, and, they are partly to blame, if you ask me, because, South Africa has laws, they have frameworks where they can deal with refugees and asylum seekers and migrants, and yet they lack political will. They hope that they'll just go away or they'll just be absorbed into communities. And which communities are they talking about? Not Sandton, not Rosebank, not, the more affluent communities where our own ministers are residing. They're talking about the townships. And so, the foreign nationals will come in, they'll go into the townships which already have meager resources. And what happens is that it starts to really get, people start to get upset. And I think that, they have nothing to offer to the community, to the people of South Africa. How do they now justify that all these years later, and Aaron Motsoaledi, I repeat, has been health minister for 10 years, that he has not been able to fix the health system? So what, for them, I mean, if you look at last year, the South African Human Rights Commission condemned the Deputy Minister of Police because he came out and he made a statement saying, well, South Africans, 80% of Johannesburg is foreigners. You have given up Johannesburg to foreigners. You and I know that's not true. 80% of Johannesburg is not foreign. So, they make these sweeping statements, and we have people like King Goodwill, we have Nomvula Mokonyane, we have Lindiwe Zulu. I mean, there's a list of ministers and government officials, top government officials. Herman Mashaba is the classic case, and who will come out and make statements. And what they don't realize is that it incites people's anger. People are already angry because they are, all these years later, they are living in places where they have no water, where their children fall into pit latrines and die, and they're angry. But, they are now, blaming foreigners. And, for us as Amnesty, that is unacceptable. And we are keeping a watch, between now and forever. We will continue to watch what government officials are saying, and because it's never based on fact.
That's where we're going to leave it. Thanks very much for coming through. Shanela Mohammed, who is the director at Amnesty International South Africa.